All right, and we are live. Welcome to the DeSci Pulse podcast. Today we have an amazing guest, Dr. Peter Fedichev. Apologies if I'm butchering your name. I hope I didn't do a horrible job. Who is running a fascinating company and a fascinating project with industry backing, which is a rare thing to see in our decentralized science space. So we are dying out of curiosity to hear more. How is it to be building a biotech startup based in Singapore, already with substantive funding, already working with pharmaceutical companies like Pfizer. So we are looking forward to a juicy conversation, and we hope it will be both interesting and useful for our audience. So welcome, Peter.
Well, thank you very much for having me.
Thank you very much for coming. So perhaps we could kick it off with a brief introduction of yourself. What's your story? How you ended up doing what you are doing currently? What was your path so far? And a short introduction to your project.
Sure. Well, I think a highly sanitized version of my past would look like I graduated from a top physics school in Russia. I got to do theoretical physics, and about 15 years ago, I switched to biology. I mean, if you ask me for the reason is like I could do maybe three things like string theory, like quantum computation, or maybe switch to biology. And fast forward 15 years, string theory is dead, quantum computer still doesn't exist, and biology is booming. So I don't think that the decision was wrong. On the joke side, on the joke side, I was hinted by somebody that, as you may know, physics is a science that is based around weapon systems, right? I mean, historically, physics got infinite funding from governments because of weapons. And we're now living in a funny time when there are no young people to fight anymore. Everyone is old and sick, meaning that people spend more money for drugs than for weapons. That kind of makes people with physics background to think maybe about switching. So here I am. So I switched to biology because to my taste, biology was complex enough systems of a system class. And physics likes to do complex systems. There is even physics of complex systems, which I kind of originating from. And I got fascinated with aging as a problem. So late Hayflick, great aging biologist, recently published a paper saying that aging is probably a problem of physics, not biology. And I kind of agree with that. I got impressed with animals that do not age. I've seen them. I mean, like mammals. I didn't care about primitive creatures, but when somebody showed me mammals that do not age, I started thinking that maybe, like in physics, there is a superconductivity phase transition or superfluidity when you are losing some kind of property, like resistance. Maybe there is a phase transition in regulatory networks when you are losing another property, like aging. Is aging like a new phase of living matter where aging does not exist? And that's how I ended up here. So we started building a company that looks at data and tries to model them with, using a textbook in physics of complex systems, with the idea to understand if aging and not aging are indeed two different phases and what are the limits of life extension, and can you actually make a drug that would stop aging. That's our mission.
Fascinating. So, in essence, you're building a company to produce more young people in the world, for the physics people to have their job once again.
Well, as Elon Musk is saying, physics is the law and everything else is recommendations. So if you want to achieve systematic success in a complex field, you should probably bring about a few physics textbooks. I think this is our unfair advantage in this field, that having a physics education is irreversible brain damage, meaning that you suffered a little bit, but once you suffered that, you have an unfair advantage. And that's what we're trying to implement now in the biology of aging.
This is fascinating. Can you actually tell us more about your transition from academia and from physics, which is most of the times highly theoretical, but also well defined. to building a company in the healthcare space in biotech, which is messy, which is full of unpredictability. How did that happen in your case? What was new for you?
Well, I think obviously in the hindsight, if I knew what is coming, I wouldn't probably switch. Right? So obviously I underestimated the difficulty of the transition. So well, I'm still pretty well published, and it's not like I totally quit academia. So I believe that in this kind of deep tech enterprise like biotechnology, the boundary between academia and companies are pretty blurred. So we see lots of wonderful science coming from companies, and even the last Nobel Prize is given to DeepMind people who are not actually attached to a specific academic group. I think also in the hindsight, I couldn't know that in advance, but I think we live in this kind of phase transition situation. I mean, even you're younger than me. When you were born, would you were thinking that you could live up to the time when NASA is not cool anymore? Right? I mean, there was this. I think everyone have had this kind of judgment that there are certain things like super deep tech that only governments can do. Obviously, nuclear fusion, space. I mean, never companies would do something like that with their short, profit-oriented approach. They would never work. But now we see that nuclear fusion is pretty much done faster by companies. Space is done infinitely faster by companies. So probably also other fields of deep tech science, DeepMind, AI was done by a company, not by a consortium of academic institutions, international, like people like CERN, for example. So I think I couldn't know that in advance, but I think the zeitgeist was at that time that it's very hard to do cross-disciplinary science in academia. I mean, really, to get a grant for something on the intersection between two fields, it's infinitely difficult. So that's why if you want to do something strange like physics of aging, a company didn't look like something outrageous. I mean, in terms of the effort, obviously it was underestimated. But I think in the long run, we are now in a situation where if you have trust by investors in what you are doing, you can commit a lot more resources from a startup as a form factor for change than from any academia institution. I mean, if you look at the typical budget of an academic institution, and if you're looking at the typical Series A budget of a startup company, you would see that in space, in biotech, in deep tech physics, you have now routinely the situation where you can deploy 10x more resources at the problem if you have sufficiently strengths, and either the way to convince people or internal conviction which correlate. So I think that at the end of the day, this is the right form factor. Science cannot deploy resources now at the rate at which business can.
This is very interesting, and let's perhaps double click on this subject, because you pointed out to a number of reasons why private enterprises are more efficient, are faster, are better in acquiring capital, are just a better vehicle to produce innovation that we need as humanity. Do you see any downsides? Do you see anything that is either potentially problematic or works better in academia as for now?
Well, it's hard to say that since I have left, because I think academia isn't in the top shape right now. We have very many people with PhD also searching for positions, competing for limited resources. I think that the government money are not accelerating as fast as the commercial money. If you look at the budget of NASA, or if you look at the budget of NIH, you wouldn't see, nothing compared to the amount of money went to biotech after COVID, for example. So I think that we have a lot more smart people with degrees, with competence to do great things that are underpowered by not sufficiently increasing budgets on the government side. So maybe 50 years ago, governments were kind of engine of innovation, maybe. But now maybe we're in a different situation where private capital learned how to do innovation. I think there has been a learning curve. So that's why 50 years ago, the governments had to build deep tech companies from the inside. I think private capital now knows how to do deep tech, which is probably good, meaning that the governments would rather be helping poor and sick people, as governments should, right? Because they have social function that private capital does not. And I think it's very hard to say because we're just in the middle of this transition. So it's very hard to do the judgment from within the process, right? But I think the trend is such that if I try to extrapolate from minus 50 years from now to plus 50 years from now, I expect that technologies will be taken over by private capital. And even maybe looking at Miller, for example, price, as a Nobel Prize before, but I mean, Nobel Prize is given to people who are kind of legends already, and the Miller Prize is probably given to people who are doing fundamental research right now. I think that the more money the private capital will extract from technologies, as it does now, the more money will go to philanthropic causes, and some of them will be scholarship to ultra fundamental science academics who are not yet ready for this kind of privately funded acceleration. But I expect, I mean, look, for the first time with crypto and with AI, nerds got money. I mean, this is also a very interesting phase transition, right? I mean, usually people in different color of suits and shorts were actually getting money and doing the technologies. Now people without shorts are getting money, and I totally believe that these people would buy a little bit less expensive yachts and will probably commit more money to nerd kind of philanthropy. I mean, this is for usual people. This will be as funny as buying expensive yachts. I mean, giving money to physicists in prize money, that also kind of social signaling. But nevertheless, I think as tastes are changing, also the allocation of philanthropic money is changing, and I expect that the ultra fundamental science will also be eventually funded from this accelerating circle.
This is very interesting, and of course, in the decentralized science space, there are also a lot of people innovating around funding of science and innovation. And to our viewers who hadn't had a chance to see how actually we met in the beginning of the conversation, Peter almost immediately started pitching his startup. So that leads me to my question: can you shed more light on the funding process in your case, on getting funded for a biotech startup? Because I think this is what a lot of people who are listening to this podcast in the context of decentralized science are going to be interested in.
Well, obviously, I mean, from the money you expect, I mean, the money should have several qualities other than being just money. I mean, first, money, of course, is the resource that is required to run experiments and pay people, which is obviously very important, like super important. On the other side, money that are coming from venture funds have other properties. Like these funds are getting stake in you, and they want to earn money, and that's why they share their networks, they share their experience, they sit on your boards, they help your company. So in order to reach this level of quality money, the money that are coming from decentralized finance should acquire all those properties. And I think that decentralized finance at this time is trying to compete. I mean, learning, not even trying, I think, learning to compete with traditional money. And by traditional money, I don't even mean banks. They don't know how to innovate. I really talk about the venture capital. So I think that we have one ecosystem in the world, which is this now already traditional venture capital. I think maybe in the third generation. The guys who started from semiconductors and went through Genentech and now funding AGI and ultra deep tech ventures. And these guys collectively have now experience and practices that allow for the first time in the history of humanity to run innovation on the private money, which is very expensive set of qualities and skills to acquire. And obviously, they have a monopoly now. So if you look at the largest startups, they are run by a clique of people who are very well connected, located in one place and everything else. On some, let's say, anthropological and social level, that means that makes some kind of a monopoly. And we know that historically, monopoly do not live long. And I would look at, well, obviously many countries are trying to recreate this innovation ecosystem, right? If you go to Emirates, if you go to Eastern European countries, every country tries to emulate this system. But as I said, it's an expensive set of skills. So it's not sufficient just to give money. This almost never works. So which means that people have to copy or to acquire this system as a whole. And as some kind of extreme attempt to do that, I think is coming from crypto community, because crypto community collectively is quite resourceful, also very young demographically, and ultra nerdish. I mean, this is a very interesting population of people. So I think these people overall share the belief in science, so they don't need to be educated on many things related to technologies. Collectively, they have enormous wealth. I mean, about $1 trillion, I think, could be mortgage for a good deep tech project. And if you look at ultra deep tech projects of our days, like flying to Mars, Elon Musk estimates that you need to deploy maybe $150 billion to get there. So I think that this community collectively has enough money to solve the biggest problem. What I think the community lacks collectively is the ways to deploy money, and that's what decentralized science is doing, automating and everything else. I think this is one thing. And the other is that this community needs to get people with experience and skills that are necessary to create these ultra large companies solving global problems on board, right? As I said, it's money and skills. The money are there. What I think needs to come is the skills. Some of crypto projects are very large, like Ethereum, right? I mean, they kind of qualify to the top league, top tier, ultra large companies in the world. So I think collectively, crypto community competes with Apple in terms of allocatable resources. But in terms of practices, other than providing money, I think there is still a long way to go. So that's why I think, I don't know, I would expect that there is at least 10 years of work together with their startups to acquire the necessary set of experiences. And that's why for almost all those startups to be successful, they need to get the other source of funding as well, if I was clear on that. So you cannot be only decentralized science. That's my point here. You don't only need money, you also need practices, advice, help, network, and everything else, which still needs to be acquired by decentralized science community.
I think that's a very good high-level overview introduction, and you're definitely singing our tune here as a bunch of nerds sitting in shorts, raising private capital and trying to build something in the type of tech that we're excited about. I think we all have that in common. And now I would love to then double click on the field that you are exploring specifically, so the science of aging. So we talked about raising money, that there is the potential in crypto and other deep tech circles to raise a lot of money, but let's talk about deploying it. So you mentioned a physics-based approach to aging, which is what you're using. Maybe you can introduce actually what it means for the type of audience that is not familiar with science of aging, and how is it different to the more conventional biological approach. And you also mentioned big data. So how does all that sit together?
Well, thank you for the question. I'll try to be short on that. Also, I think humanity has achieved most when applied engineering mindset to big problems. So, like first principle, physics-based. I mean, physics and engineering are very connected issues. There are many good books to read about what happened about 400 years ago in Europe. Then suddenly the technology started growing in one place in the world. And maybe to the tune of your podcast, when people try to reverse engineer what happened in Europe, Europe was not even the richest place in the world at that time. So it wasn't just a matter of allocating resources. So something else happened. So one thing that people mention about Europe is that it was decentralized, right? There were too many countries there competing with each other, and Christopher Columbus got rejected everywhere, but got money for his expedition in one place. So startups, pitching was already there, and there were many funding sources there. So that's one thing. But now getting back to physics is that the other thing that happened is that spontaneously in Europe, people started building models of reality that did not just describe data like empirical. Having empirical value is good, like predict your next experiment. And many people, by the way, think that this is the only goal of science. The actual goal of science is not just to explain the experiment, but not only to describe the data in the experiment, but actually to explain what's going on. So people started building models that explained the reality. So people started building narratives. They constructed the language, mathematics, to formalize those narratives, and boom, suddenly you have explanations on how stars are moving, how heat engines are working, and everything got kind of predictable in just with numbers. People started thinking with numbers, and that's how I think that is what been happening for 400 years. Like physics has been expanding. People learned how to do quantitative modeling of increasingly complex systems, started building rockets, engines, and everything else. And at every stage, people knew exactly what to build. Like when people were sending spacecrafts to the moon, they succeeded not because they were sending spacecraft-looking objects toward moon with arbitrary amount of fuel, oxygen, and everything else, but exactly at the point when the mathematics of space flight was developed sufficiently to actually knew up to 200 kilograms what is the fuel requirement for the flight. So that, in my mind, relates to biology very well. So making a new drug is a very expensive enterprise. So people are talking about billions of dollars to deploy right now. And actually, space flight is also, to make a new airspace system is also in the range of billions and tens of billions of dollars. So it's not like people are afraid to allocate billions of dollars for something interesting. The difference between airspace and biotech is that there are more countries that are building airspace systems than countries that are developing drugs. So developing drugs is still more complicated than developing any sophisticated technology than we have right now. Probably biotech is the most sophisticated technology than humans have right now. And the issue here is that people don't understand what we are doing. If you think about number of failures in clinical trials, it's really ridiculous. We have less than 1 in 10 drugs entering clinical trials actually succeeding right now. And these are experiments with humans. So this is very expensive. So when I'm saying that biology has to become physics-based is that we need to find narratives in biology that allow for modeling to be put in numbers, so that if we think about making a drug that will extend human life 5 times, we wouldn't just test anything that extends life by a little bit. We would know what kind of drugs extend life by a lot and which kind of drugs do not. So we need to have the same level of understanding of basic biology as we have the understanding of spaceflight. And then I believe investors will start pour infinite money into biotechnology, because when investors would realize that people understand what they are doing, not just produce random experiments, some of them are positive, then I think there will be infinite money to be deployed. And the way we're trying to achieve that is that we are looking at the data. Humans are now the most studied animals on Earth. We have lots of electronic medical records, tens of millions of people are genotyped. So, the amount of data is just ridiculous now. And what we're trying to do is the same what people are doing for climate, for weather, for market prediction. We're just running increasingly sophisticated models, trying to predict the future medical history of individuals from their past medical histories. We try to understand how diseases affect each other, how diseases interact with each other, how they affect aging, how aging affects diseases, if aging is different from diseases, by the way. And then we we compare the outcomes of our models with molecular-rich data sets like proteomics, genetics, and everything else. And we're looking for targets that can slow down the pathological processes. So to cut the long story short, we try to build it in a way that is compatible with narratives in physics, because we want to use the prior knowledge. That's important. And we kind of understand now, and that maybe to return to the discussion, is that unfortunately most of human aging is not reversible, not in 15 years from now, but it's stoppable. You can actually build drugs that will stop human aging. This will produce multiple fold extension in human lifespan. And this is not a fantasy. You can do it. You can do it from bottom up. using models that we're developing. And on top of that, we can help pharma to develop drugs against specific diseases in ways that that the action does not depend on aging. These drugs will help people of any age. And that's how we're trying to build our company. We're trying to help pharma to do best drugs against diseases from our data. We are studying aging from the same of data and models. We talk to pharma, we educate them about the relation between aging and diseases, which means that if we're successful in 5 years, maybe pharma will start buying drugs against aging because pharma is interested in aging. They're trying to understand more about aging, and we're trying to provide, to satisfy their curiosity and still pragmatically help them solving their essential medical problems.
I really loved your analogy of biotechnology and space travel, because I think that what they have in common is that they have been human desires for thousands of years. So people in ancient Egypt wanted to live forever and preserved their dead and buried them in pyramids. And they also had people who were looking at the stars, wondering what's out there. So I think both of those challenges have this aspect of being deeply inspirational to people. And I think that what Elon does particularly well is he just drives this message home of being a space-faring civilization, a multi-planet species. What we, I think, are trying to see more and more, and they are people who are emboldened also to project this kind of bold message in longevity, right? So take a very exciting goal, we want to live forever, and actually say it out loud, see whether it sticks. And apparently it does. What's interesting for me from what you have said is that it actually takes education for people in the pharmaceutical sector to understand the size of the opportunity, right? Because everybody has this risk factor, which is aging. Everybody theoretically could be eligible for treatment. And of course, everybody could clearly benefit from the treatment, right? From the health span and lifespan expansion. So why is it that you actually need to do the education if the opportunity is so much in the plain sight?
Well, I agree with you that I think the dream about space and dream about immortality are the defining dreams, defining thoughts in human beings. I think when consciousness appeared for the first time, it got shell-shocked immediately from the vastness of space and finiteness of human life. So I think that these are the most universal kind of, in a Freudian sense, the two most universal drivers among most human beings. And for the space flight, I agree that we see this problem solved. And even this guy, he wants to fly to Mars, but he cannot get enough investment support to build a company that will get people living on Mars. He has to build Starlink in a boring way, right, in order to fund Mars. So I would keep these analogies to longevity even further. It's like, who is against humans living on all planets in the galaxy? Like nobody, I think, right? Everyone wants to have it.
Well, I think
right?
that you could hear some dissenting views of the impact of rocketry on climate change and burning resources and fuel to be a space-faring species, while we are increasingly draining our own home planet. So I would say that there are critics, but I would also acknowledge that they are a minority.
Yeah, I think they are a minority because, let's not go into that because obviously sending people to other planets is a natural solution to overpopulation and keeping, Earth intact. What I'm saying is that even though you're saying that this dream is brought home by Elon Musk, it's not precisely that. With his pitching potential, which is kind of infinite on the scale of a normal Homo sapiens, this guy is not able to generate enough support. Merrill Lynch does not give him money to occupy Mars, which means that even this guy has to have a hybrid strategy where he is earning money by disrupting communications to get enough money to play for his dream. So I think the situation in longevity is the same. people understand the opportunity. Moreover, it's decided that we are living longer. As you know, we stopped producing new people, and we are living longer, which means that we have a lot more diseases. And it's not like there is a committee with United Nations that decided it to be that way. So Homo sapiens, in its emergent species capacity, decided to do it. This is our reaction to demographic transition. I think is the technological singularity in disguise. As you can see, all of that is happening at the same time. So the only choice we have is what to do with old people. I mean, there will be a lot of old people with lots of diseases, and I don't know, we can either avoid thinking about this problem, and then we'll have lots of people with diseases and quite a few people capable to work. And this is a disaster for social, pension, and everything else systems. And of course, if there were a solution against aging, the governments will buy, in a civilized world will buy it, right? It's like with COVID. So remember, when there was this pandemic, the load on the medical system was very large, and the governments spent $70 billion for vaccines, essentially to delay the wave of patients to the clinics, to make sure that the healthcare system will actually cope with the amount of people with the disease. So the situation with chronic diseases, age-related diseases, is the same. It's just a little bit longer in time. But in terms of the amount of stress on the healthcare system is enormous, which means that governments will pay this amount and maybe 10x more to actually soften the wave, the silver tsunami of all those, to reduce the healthcare shock. So I think commercially the opportunity is there, and more players actually understand that the opportunity is there. What is missing, I think, is that somebody, I mean, one Führer of a bad European nation spent a reasonable amount of money to get space tech during World War II. And then Allies got space tech for free from Germany. And then it took another 50 years for Elon Musk to get all the technological problems sorted out to the extent that you can build a startup against that. So I think aging is now in the situation which is roughly coincides with the development of rocketry during World War II. I mean, you can do impressive examples, but you cannot make technological solutions yet, which means that there has to be some kind of impressive amount of research still to be done before startups can actually pick it up. We just hope that 50 years ago, that took 50 years because of the overall technological development. I mean, the computation, successes in physics, chemistry, and everything else. I just hope that this time in history for aging, we will have to spend a lot less than 50 years because of artificial intelligence, the amount of data, success in physics, drug discovery, and everything else. I think it will take not 50, but maybe 5 to 10 years to develop, and that's the place where startups will pick it up. So I think we're living just at the boundary of this transition, and that's why it's very interesting to be ready. Drug discovery is a steep learning curve, so you would better start at 10 years before the transition occurs to get there in time.
That's really fascinating, and once again, I love the comparisons there. And just to talk about the size of the opportunity a little bit more, to get your informed guess on maybe on one hand the optimistic scenario, and on another hand like the more realistic scenario. How far do you think we will actually get in, I guess, like in the next 10 years and also in our lifetimes, on eradicating all the aging-related diseases? And I think you're separating that from slowing or stopping aging itself. So are we going to achieve practical immortality within our lifetime, or how far can we actually get?
Okay, so how to say, I would rather be boring here. So in biotech, to develop a drug takes, 7 to 10 years, which means that it's very easy to predict what's about to happen in 10 years, because for that you just need to see what is coming into the development, right? So in biotech, once again, the prediction for 10 years is easy. So what we see for 10 years, really what is about to get into doctors' hands in 10 years from now, all the technologies are already known, right? Because of this time lag. And we already see some visions of the future. Ozempic is the drug that will most probably extend human lifespan by a few years. Medicine has been successful in extending human lifespan. So as you may know, eradication of one chronic disease gives maybe 1 to 3 years of lifespan extension. And that's what pharma and medicine are doing. I mean, they're just getting a new disease, like it's been cardiovascular diseases after World War II. They reduce the risk of cardiovascular diseases to the point that now people, like many people, are suffering from cancer. I mean, 50 years ago, you had a chance to die before cancer. Now there is no such a chance anymore. Most of the people alive today will face cancer. Fortunately, 50% survival, 10-year survival is more than 50% now for cancers on average. This number is expected to grow. The problem is that people who survive cancer are not in a very good shape physically, because struggle against cancer is very expensive in medical terms, not only cost-wise, but also in terms of physiological potentials. And then, as you know, if and when, rather sooner than later, when people get cancer under control, everyone will live up to Alzheimer's disease, right? And as you may know, the Alzheimer's disease pipeline is empty, essentially. There has been the first registration a few years ago, like 2 years ago, but people are still quarreling. I mean, quite a number of people on FDA review board resigned because of the lack of effect there, which I still think is a good decision, because you have to approve at least something, so the investors will get at least something for their money, so that they can fund more research in that direction. What I'm trying to tell you is that even though the strategy of fighting disease after disease is kind of paying off, and with Ozempic, once again, we're getting a situation now where chances to die from other causes other than diabetes and obesity are also reducing in the population. So most probably Ozempic is working as a life-extending drug, maybe the strongest life-extended drug that we're having right now. Of course, this has to be proven. But also, we're not talking about even plus 20 years of life, right? I mean, we are discussing now maybe 5 years effect, which means that most probably within 10 years from now, we will have a bunch of drugs with different mechanisms of action, individually increasing human lifespan maybe 3 to 5 years, which means that by a combination of that, you can probably get 10 years of life, which is, by the way, comparable with the effect of lifestyle, but with the advantage that you don't need to change your lifestyle, which is, by the way, I mean, the example of smoking is telling you that you can extend your life by maybe 7 years if you quit smoking, but this doesn't help. People don't quit smoking. So that's why I wouldn't underestimate the effect of getting the effect of lifestyle without changing the lifestyle. This will work. So I think that if you look at the structure of X prize, the $100 million that is promised to somebody who will extend human life by 10 years, I think it's super achievable within 10 years. I think it will be done, which means that for the first time ever, for a moment, people will have zero longevity rate, right? I mean, if in 10 years you get a drug that will work for 10 years in effect, I mean, for a moment, aging will be stopped and people will get another 5 to 10 years of life easily on average, well, easily. This will help a lot of people. This will get $1 trillion in earnings and will get a Nobel Prize, I'm sure, but people will still age. And as you know, as you age, your chances to die double every 8 years, which means that this effect will be negated in something like 10 years, right? I mean, this will be just kind of deceleration of aging, instantaneous, but nothing more than that. In order to make drugs that reduce the rate of aging, you have to use another class of pharmacology, which is not yet in clinical trials. So my somewhat educated guess is that you will get 10 years in 10 years with probability more than 80%. And I hope that within these 10 years, some other strange people will design a totally new kind of drug that will attempt to intercept human aging, to stop human aging. That's what we're doing and other people are trying to do. And then it means that, I mean, it's hard to say how long that will take. If I hope, I mean, for me it's personal. I must make it in less than 10 years. If we're successful, then in 10 years, you will get 10 years, and in another 10 free years, you will get a drug that will reduce the rate of human aging. So this is my kind of timeline. But don't expect, miracles. Human aging is not reversible. I'm warning you about that, which means that the damage that you would accumulate in 10 years of waiting will be with you forever. So don't underestimate healthy lifestyles and everything else. Science is not omnipotent here.
So it sounds like you're disagreeing with the classic Aubrey de Grey reversible aging model.
Yes, moreover, I believe that we are tricked into intuition, thinking that aging is reversible from our mice models. I personally did experiments where mice were rejuvenated, so we were able to extend mice lifespan with short treatments, which is rejuvenation for all practical means. And at the same time, I don't believe that human aging is reversible, because human and mice aging is different. And for that, by the way, you have to learn physics. So this is the outcome of the models that we're developing. So mice are models of humans very late in life, when humans are very sick. So the drugs that extend mice lifespan will work in humans very late in life. And since our late in life stage is very short, you can only extend that by that much, meaning that you can extend last 10 years of life into last 20 years of life with the drugs that work in mice. Humans are extremely successful agers compared to mice. We live 50 times more. So, of course, it's very hard to get impressed with drugs that are working well in mice if you would want to extend lifespan in humans. And that's why we are calling up for the development of a totally new pharmacology that is working in humans, not in mice. And by the way, this will almost not work in mice, because mice still don't have a chance to experience human-like aging because of their very short lifespan. I think this is a very interesting, and unfortunate distinction that drives intuition funding lots of processes in the longevity field and delays the ultimate victory.
I think
Some
that's
bad news for our furry friends. Sorry, go on, Wojciech.
Yeah, I want to get a little bit philosophical, but it's hard not to get philosophical with a question of immortality and expanded lifespan. I think what's beautiful and terrifying with complex biological systems in the same time is that they are still unpredictable. So we can change one of the aspects, and it's very hard to predict what will be the aspect on societal, on cultural, on military aspects of human activity, right? What are your broad thoughts, the impact of prolonged lifespan for us as a society and for us as individual beings? I imagine we would think very differently, for example, about raising offspring, for example, about acquiring education, about what we value at different stages of life. And what we value as a society, right? How leaders, for example, transition, how we choose our politicians, and so on and so on. Are you an optimist in a sense that expanding human lifespan will actually help us to be more wholesome, happy, peaceful, and accomplished species? Or can it also result in actually the opposite? So are you more of an optimist, which I would assume you are, being an entrepreneur, or are you a realist, or do you even see some threats that keep you awake at night?
Well, of course, I'm an optimist. Although when I look out to the skies, I still like to bring this analogy all the time. And the most astonishing problem in the skies is that there are no people like us there, which means that there are lots of filters in the historical process, and most civilizations do not pass them. So it's very hard. A pessimist is a well-informed optimist. So whenever I'm looking up, I'm getting a grain of salt into my optimistic soup. Nevertheless, I think that I'm coming from physics, and physics has very interesting view on complex systems, and human society is a complex system. And the most surprising outcome from complex physics theory is that really complex systems have lots of correlated behaviors. So they simplify, they depend on very few factors. I mean, ideal gas, when no molecules interact with others, each molecule is on its own. But in really complex systems, there is a lot of collective behavior. So why am I an optimist? Because when I look at the last 100 years, I see that the demographic transition started to occur. So if you ask yourself why demographic transition occurs, as I said, not because somebody is thinking about let's get less kids. I mean, in China they try to do that, but I mean, there was no such decision. It's a decentralized decision, right? It's called emergent behavior in physics, by the way, when no part of a system knows what the whole system is doing, and since they are doing that. So why do we do demographic transition? And the reason is very interesting, is that human progress is accumulation of knowledge and head count. And as you may know, the human knowledge and headcount got correlated, and every next doubling was twice as faster as the previous doubling. So this is called the hyperbolic dependence. So, when singularity people talk, they talk about exponential dependencies, and this is boring because exponent never reaches the infinity. It takes infinite time to get infinity with exponent. But when your next doubling is twice as fast as the previous doubling, you get to infinity in a finite time. And that time was predicted by extrapolation in the 60s to 2026, by the way, 15th of February, 2026. And since we're kind of close to that date, we see that singularity is not about to happen, right? So how people dodged the singularity, it's very, very interesting. So if you need to increase headcount at twice the rate every time, at some point your headcount increase, the birth rate should be faster than your development time. And this is not possible. It's a hardware impossible with humans. So humanity as a complex system reached its hardware limit at about 1980. And then, the progress had to go somehow. So what happened is that people, counterintuitively, they started reducing birth rate and increasing lifespan, right? So that to make more from the head, instead of building more heads, more humans, they started exploiting humans more, right? To get them living longer in a productive shape. If you look at people who are now 50 or 60, and if you compare them to the people of the same age in 19th century, you would see that we're a lot healthier right now and a lot more productive right now. So look, once again, for hardware reasons, we are not capable anymore to reproduce at a sufficient rate, which means that we have to build a new quality in humans. And that new quality implies longer productive age, whatever it means, and reduced mortality rate, reduced mortality and reduce birth rates. Why birth rates? Because birth rates are taking energy from productivity, and if you want to make more productive men, you have to reduce birth rates. Once again, that is the only hardware compatible solution that our species actually found as a solution to technological singularity. And now you're asking me, what would the life be after this singularity, after we pass the phase transition? As you know from physics, things that are exponential at the phase transition are the properties of the new phase. So computation is developing exponentially at the phase transition. So in the new phase, we'll have a lot more computation, right? So you see all the exponential technologies are actually the things that will be dominant in the new phase. So which means that we will have, just look at the list of exponential technologies and you will see that. And obviously the technologies that are related to life extension are there. So I think we will have a new form of human being, which will be most probably biologically engineered by humans to dodge age-related diseases as our lifespan increases, to maintain the productivity. And then if you ask me what will happen, let me bring once again this analogy with spaceflight. So as you may know, Soviets didn't put a man to the moon because somebody, Sergei Korolev, died of cancer, and he was the chief designer of the space systems in Soviet Union. So after he died, the program failed. Americans got to the moon first, and I think if Russians put the people on the moon, Americans will have to fly to Mars. If Korolev lived, Americans would have to put people on Mars, and we would be living in a totally different world now. And I think only 5 years of life, only 5 extra years of life for Sergei Korolev could actually bifurcate us to the spacefaring society right now. And it's just 5 years. 5 years is totally technologically possible. So just think how much you can get if people would live 50 years more than they live now. So if you look at, maybe I will dwell on this a little bit. So other than diseases, what happens after 40 is that cognitive functions are going down. VO2 max are going down. So physical capacity is going down. This is not a function of diseases. This is what is called normal aging. If you look at chess players, 60 years old chess player cannot beat 16 years old chess player normally, right? You don't see champions playing at 60 years old, which means that at this time in history, to get on the top of your profession, it requires 40 years, right? Think about jet fighter pilots, special forces soldiers, 40 years. And then your cognitive skills are going down. So maybe we are not getting a new theory of everything just because we need humans to work in a good health for another 20 years. and these are not available right now due to aging. So I think solving aging will give us productivity that is non-linear, and that's why I think this non-linear boost of productivity will help sort out all the other things. I'm sorry for being long, but
no, this is actually super interesting. I would actually argue that it's not necessarily obvious that people will be interested in increasing productivity. If we live longer, then the point in our life where we become financially independent and can do whatever we find makes us happy can be relatively faster in people's lives. I also think that people tend to self-regulate the population propagation by limiting the birth rate. So the more people are in the world, the more viciously we have to compete for natural resources, the more options there are for us to pursue what we find to be fulfilling. And somehow people in Western developed societies tend to have less children. I think this is an issue of resource allocation. Child rearing in Western world is expensive.
yes.
So I think that's why we are seeing, declining birth rates counterintuitively, because of course at the basic level we could afford to have probably tens of children right now and feed them and clothe them.
Once again, I'm sorry for interrupting. If it's compensated by reduced mortality, you see the saturation of population instead of decline. So, the models predict that the population will actually stabilize, and they may stabilize at the level of maybe 12 to 15 billion people. And I think it's nothing for the resources. We can generate energy and generate wealth and food for this amount of people easily. I think what's more important is that since you reduce mortality, you are now getting elder people to do decisions. And if they are not compromised by aging, which I'm not, look at our politicians, some of them are clearly compromised by aging. But if they are not, I think this will provide a stabilizing effect on the population. Look, if you don't have 20 years old, nobody wants to fight. Even now, look at the situation. We have a conflict in the world. And let's say the side of the good does not have enough soldiers. This is also a part of the phase transition, right? So the wars can get extinct due to the phase transition, which is very interesting situation. I think unknown in the history of humanity before. I think the value
Unless
of life
drones fighting instead of soldiers, which is already happening.
Yeah, the value of life will increase, right? So I think that overall, I think, as we have started, this is really a very humanitarian goal to reduce mortality and increase life, right? Because this is really something that defines us as human beings. So before we are getting substituted by AGI, as a sportsman, I want to get this problem solved, right? For the sake of my species, right? Because that was on the plan from the day one, I would say. So I do think that this will transform the way we think about our life, success, and everything else. And there will be 12 billion instances to sort these things out for the time a lot longer than we have now. And I think this combined ingenuity will be able to sort these things out. It's just ridiculously how short on the scale of the problems that we are facing is human life right now. And I think that the future is only bright when you have a lot more people who value their life a lot more than we do now.
The future is only bright. Let's repopulate the galaxy with billions of ultra longevity driven people and all the conflicts in the world. I think that's a really good high note to end this conversation. We're just running on the hour. But this has been amazing. We've covered so much, from deeply technical stuff to very philosophical. So I've really enjoyed this, I have to say.
Well, thank you very much for having me. It's delighting to talk about philosophy, because that's what humans are built for, I think.
Absolutely. It has been fascinating, Peter, and thank you for your time.
Thank you.
I feel like we could easily do another call like this for another hour, but maybe another time.
Sure. Thank you. Thank you for having me. It was relaxing.
Have a great day.
Thank you very much.